Hey everybody, it's Tim Reha here live at Digital Health Summit CES 2014. Really want to thank Idealife for sponsoring the event this year. So we had this awesome super session this morning, the Digital Health Manifesto, with really all-star talent out there. And I wanted to say hi to, we got James Mault, who's the MD and Vice President, Chief Medical Officer for Qualcomm Life. How you doing?
Hey, good. Thanks for having me.
Yeah, so just a mob of excitement this morning. Tell everybody about your background, James.
Well, I'm a cardiothoracic surgeon in a strange place. I'm the Chief Medical Officer of Qualcomm Life as the result of an acquisition of a company that I started about 4 years ago for specifically the enablement of the delivery of digital care and remote patient monitoring.
So you're an entrepreneur by trade.
Entrepreneur and cardiac surgeon at the same time,
Wow,
but
cool.
former, I guess.
So who was on the panel today, and what was the main kind of topic?
Well, it was really, like you said, an all-star panel. We had Reed Tuxton, formerly the Chief Medical Officer of United Healthcare, leading it. And we had a venture capitalist, we had a patient advocate, we had somebody from Kaiser on the care delivery network. Obviously, we had our talk show host, physician, who I think you'll be interviewing as well. It really was a lot of fun.
Yeah, Travis Stork, he actually unfortunately had to get on a plane to go tape in LA. And so what were some salvos that were happening? What was hot on the panel?
Well, I think the key message here is that this market is finally happening. It's been long anticipated, and the stars are aligning. And there are obviously multiple stars, and it's a very complicated scenario. But I think most notably, you have patient advocacy and patient engagement coming to the forefront, and that makes things happen in a lot of ways, both on a health policy and political setting, as well as motivating employers and payers and even physician practices. But I think at the same time, none of that can succeed unless you have a massive change in the mindset of how we deliver healthcare, which is now happening for a lot of reasons. The Affordable Care Act, but also the healthcare economics themselves, independent of the Affordable Care Act, that are changing the way doctors and hospitals are going to get paid for the delivery of care. Most notably, a fee-for-service model, as we call it, which has been the basis of our healthcare system for decades. It tends to drive a healthcare system focused on sick care.
It's like solve the problem after it happens instead of prevent it.
Yeah, well, you have a heart attack and you come into the hospital and we get paid to save your life because you're having a heart attack. And there really historically wasn't a driver, an incentive to pay attention to you long before you have that heart attack and in keeping you healthy and out of the hospital. So with these new payment models, which are acronyms or alphabet soup like ACOs and bundled payments, accountable care acts, accountable care organizations. What these are doing is saying, hey, instead of you getting paid every time somebody comes to the hospital or every time somebody comes to your clinic, we're just going to give you one payment to cover 10,000 or 100,000 lives, and you have to achieve a certain level of quality. But if you're able to do that more cost effectively, like if you're not ordering 3 sets of EKGs and 2 X-rays and double the CAT scans because you're not sharing records with each other, then you can keep that savings. But if you want to order duplicate CAT scans and 3 EKGs, knock yourself out, you'll have to pay the difference out of your practice for the money that goes, the expenses beyond what we're going to give you. Well, that changes all sorts of behaviors, because now you're going to start to do lots of things that keep people out of the hospital, like coordinating care and reducing duplicate tests and services and remote patient monitoring. So what you've just done is flip the switch on a long-awaited market for home health nursing and remote patient monitoring and care coordination.
So you're saying it's a drastic shift, like literally going from 0 to 500K patients.
With the flip of the switch. And a lot of organizations are in a bit of a panic because this is a very different change of their world. And in fact, we have them coming to us saying, whoa, wait a minute, we've got nurse case managers, but they can handle 100 patients a week, and we're taking on 500,000 patients that are essentially going to need nurse case management so we can keep them out of the clinic and out of the hospital. How are we going to do this? So that's where it's exciting to be at Qualcomm, because Qualcomm has had a lot to do with the digital revolution and moving from phone calls and fax machines as the basis of how we exchange information and coordinate with each other to wireless and remote. And the other thing that we talked about in the conference is healthcare is now moving away from a face-to-face visit. Again, you used to get paid every time you saw a patient, and the patient saw the doctor, and that's how we delivered care. Well, that's called synchronous communication, and essentially every other sector in our economy has moved from synchronous to asynchronous because of wireless communication. We don't make phone calls much anymore. In fact, the data shows that with these devices, we call them cell phones. We only make phone calls 16% of the time that we're using this device. The other 84% is my kids are texting. They won't answer, Dad, but if I text them, I know I'll get a text right back. Well, why? Well, they tell me, well, Dad, if I answer your call, then I'm texting with 10 other friends simultaneously. So healthcare is now about to move into the world of asynchronous communication, where one nurse case manager can now monitor and manage 1,000 patients simultaneously, because the technology is asking the questions, collecting the data, collecting the home ultrasounds, and then the other key part of it is what's called exception management, because we're making it possible for all this data to come flowing in. That's information overload for a clinician who's suddenly saying, wait, I don't have somebody that's going to look at all these blood pressure measurements. So what you need is to be able to have technology to collect the data and share it to all the appropriate individuals, but then to apply a rules logic and say, out of these 1,000 patients, here's the 12 that need this nurse's attention today. Exactly. And the economy, this is where you move into a scalable model to be able to do population level healthcare. Now, the other cool thing about this is that we're able to move from what's called episodic care, because you could only see your doctor once every 6 months, and that's all the system could afford. But now with technology, we will be able to go from episodic care to continuous care based on real-time monitoring. Exactly. And then when you need attention, you may not even know it, but the system will be able to see the information and say, hey, you're headed for trouble. Let's bring you to the attention of the appropriate person. And that may be your doctor, but it may be the pharmacist, or it may be the dietitian. And this is really cool, because what it does is it allocates the appropriate medical resource to a demonstrated level of need. And that's what we should be doing with our healthcare dollar. And it's great for patients, because what you want is care when you need it, where you need it, and have it high quality and affordable.
So we're just talking about skiing, so ski patrollers will have mobile systems.
Absolutely. I mean, we have wearable technology now. I mean, you're seeing that with the quantified self. And isn't that cool? And the things that is driving, are actually more profound than people are realizing at the moment. And it goes beyond just fitness. I mean, we have a beautiful study out of Mayo Clinic showing a Fitbit given to post-cardiac surgery patients itself is predictive of whether or not they're going to have post-operative complications just by being able to monitor the Fitbit data. And it's kind of obvious. If somebody is laying around on the couch, instead of up and moving around, they're probably not doing as well.
So we could go for days here. There's so many more questions I have to ask. How do people catch with you online?
I think we have a great blog with Qualcomm Life and a number of our team members. We're very excited to interact with an ecosystem that's rapidly building with what we're doing on the TuneNet mobile system and TuneNet in general, as well as our Healthy Circles care coordination and care management infrastructure.
Well, it's fascinating. It was great to catch up with you, James. I appreciate your time, and everyone's excited to have you at the Digital Health Summit. Cheers.
Thanks for your time. Appreciate it.